Up next on Cycle of Health.
Tonight's topic, beautiful, healthy skin. A prominent Syracuse dermatologist discusses skin health with the plastic surgeon who removed my own potentially deadly skin cancer, and see how paramedical tattooing is a post-surgical and also cosmetic option.
This program is brought to you by the members of WCNY. Thank you.
Cancer. It's not just a diagnosis. It's a complex opponent, one that can alter the course of your life. Every move, every decision holds tremendous weight. St. Joseph's Health has partnered with Roswell Park, the region's only nationally designated comprehensive cancer center, to offer you access to personalized therapies and leading oncologists right in our community. Among the many moves you can make, this one holds the power to change your life for the better.
Hello and welcome to Cycle of Health. I'm your host, Dr. Rich O'Neill. Tonight's topic, beautiful, healthy skin. We're here to discuss all things skin care, and loving the skin you're in. Joining us are Dr. Joyce Farah, dermatologist with Farah Dermatology and Cosmetics, and Dr. Enrique Armenta, plastic surgeon with Syracuse Plastic Surgery. Now, believe it or not, your skin is the body's largest organ, and it needs to be treated with great care. It serves several important functions: regulates body temperature, protects us from harmful microbes and UV rays, prevents dehydration, and of course, not to get too technical here, but it just holds all of our inside stuff where it belongs, right inside. So now, I understand there are some 12,000 diagnosable skin conditions, not including aging-itis and gravity syndrome. What are some of the most common conditions people come to see you folks for?
Well, how much time do you have?
Well, not 12,000, not all 12,000.
No, we'll start actually, a lot of rashes of various reasons, psoriasis, eczema, and many, many others. Most importantly, a lot of people come to have their skin checks to make sure they don't have skin cancer.
I do that every year, only every 6 months for a while.
It's very important. And acne is a big one, especially in the younger in the teenage and young adult population.
I think, Dr. Joyce, I still have some of the same zits I had in high school. It's really
well, you're still young.
There we go. Thank you.
Well, that's, to Dr. Farah, most of the patients that will go to her would be because of lesions or treatments that could be maybe treated with external or internal medications. When they decide to come to a plastic surgeon, usually they are thinking more on surgery. They don't come to us for a prescription. They come us for surgery.
So medical, not surgical, and
yes,
that's basically the divide.
Even though the two specialties overlap a lot today, but there's a distinction between one and the other. Now, let me just tell you that in our group, we are 3 right now, and by the end of the year, we'll be 5. It will be the first time in Syracuse that we 5 plastic surgeons. Each one would dedicate to what they like most, so we will have a variety of treatments, a variety of things that we never had before.
Some subspecialties.
Yep. Correct.
So, I have 3 new grandkids who are like 2.5 and younger, and one of the things I've noticed is their skin is like one of the 7 wonders of the world.
Yes.
It's like so smooth, and it even smells good. It smells like nothing else. It's just amazing how it smells. So what are the best things we can do for ourselves to keep our skin as much like baby skin as it can? What can we do?
Well, from my perspective, the number one thing you could do is actually protect your skin from UV radiation. So that would involve using sunscreen on a regular basis, not using tanning beds, using protective clothing whenever you can. You know, you have to enjoy your life and do what you like to do, but you can time when you do your activities to minimize the most intense UV exposure.
Which is like, I think, 10 to 4, is that right?
Yes,
So
that's about right. 10 to 3, 10 to 4. And it depends where you live, because lower latitudes closer to the equator, you have more intense UV exposure. In higher altitudes, the atmosphere is thinner, you have higher UV exposures as well. And of course, by the water and snow.
Well, I would like to add another thing, which people forget about it. Smoking is one of the worst things you could do for your facial skin.
Absolutely.
Yeah.
It's amazing the difference between twins. When you see a twin that doesn't smoke next to a twin that smokes, it's like 20 years difference.
Can't you tell just by looking at a patient without even asking them yet that that's a smoker? You can tell from the
You can
skin.
tell. Sometimes it's just the smell. But
besides the smell.
But they don't notice it anymore,
No,
right?
you can tell from their skin.
But
when
the skin has complete different appearance.
They don't heal as well. You know, you want to do cosmetic procedures, the outcomes not as well.
Cosmetic procedures are a big problem for a smoker. Even if it's stop smoking, it still could have complications. And we see a lot with the breast cancer reconstructions. Patients that have smoked, even though if they have stopped, usually they're going to have problems. Even 4 or 5 years after stop smoking, they still have problems.
So, number one thing, if you want to take care of your skin, don't smoke.
Correct.
Right? And you live 6 to 7 years longer besides.
Right.
And, you know, so, and one of the things, you mentioned surgical procedures and a lot of medical procedures. I know that there are now some new options for those who have undergone procedures like paramedical tattooing. Our crew went out to Painted Lady Studios to find out more. Let's take a look.
My business is Painted Lady Studios. It is a skincare and permanent makeup studio. We're located in Armory Square, downtown Syracuse. Paramedical tattooing is a procedure that is designed to bring normalcy back to someone who's been through usually a traumatic experience, scar camouflage or areola restoration, either a surgery or some sort of injury, bringing that skin back to appearing as close to normal as possible. My job is to blend the scar to make it match the natural skin as much as possible, whereas body tattoo artists, traditional tattoo artists, are looking to make their things, making their creations stand out. Val had areola restoration and scar camouflage both at the same time. Val did have what's commonly known as top surgery, a mastectomy, and in that case, it was a gender confirming surgery. We always are going to start with a consultation, speaking with the client to discuss their origins of their scar, whether it be from surgery or a trauma. And then the age of the scar as well is important. We want to make sure that the scar is fully healed and is no longer changing color. From there, we go into picking the correct color, which is always a blend, and there's never just one straight color because skin is never one straight color. So I usually use a mix of 3 to 5 blended together, applied in translucent layers.
That's Bill's first tattoo. Really? Yeah. Get out of here! That's awesome.
I have a number of people who I'm working with for their very first tattoo. I've also had some people who've had bad experiences in the past. So I do deal with a lot of clients with apprehension, a little bit of nerves. I tell everyone, it's okay. It's a tattoo. It's normal to be a little bit nervous. I think you're good. We'll see. No promises. I very rarely, I don't think ever have had anyone regret getting this. Almost everyone says, I can't believe I waited that long and I should have done this sooner. Sometimes I will numb an area with a topical lidocaine if necessary. After the numbing step is complete, we go right in and we start to apply the pigment through a traditional tattooing process. Paramedical tattooing is important because it just helps to bring a little bit of healing back to the person by looking down and seeing that scar minimized or camouflaged, wiped away as much as possible. It usually is that last step of healing, bringing that full circle, closing up that chapter of their lives usually. As a service, my absolute favorite part is the ending. Seeing my client's reaction, their response to the procedure. So many times, especially with a breast cancer survivor or something like that, nobody leaves the room without tears in their eyes. It's a very emotional process, but a very rewarding one as well for everyone involved.
So let's shift to talking about kids. And how do we protect our kids' skin?
So I think the most important thing is to instill in children as they're growing up good sun protection habits, because it's really hard to break habits, as we all know. So to begin with, I think to have regular sunscreen use on the kids, and there are some sun-safe sunscreens. There are some brands that market themselves for children,
Particularly
and those are all
kids.
fine, yes. And a lot of those have some of the physical blockers, which are zinc and titanium. That's easy to remember for people.
Zinc and titanium.
Right, and those are the sunscreens that actually sit on top of the skin and don't get absorbed in, and those actually reflect the light off.
So the zinc and titanium, they're on top. They act like a reflector.
Correct. That's basically how they work.
And for little kids, you don't want the chemical sunscreens.
I mean, I would tend to say that, especially because children's skin is not very mature, so the way they absorb things that you put on them is much more intense and different than what an adult's mature skin does, because their skin-body ratio and the skin maturity lends itself to more systemic absorption, definitely.
So more likely to go into their
Correct.
whole
That's
body.
with anything. That's even with medicated creams or anything. So you do have to be careful with small children. And I would actually start them with good habits of wearing hats and protective clothing. I would go so far as to wear sunglasses as well, because down the road you want to protect them from cataracts.
You mentioned, I'm thinking of my grandkids again, and I have these pictures, and maybe I'll be able to bring some in and they can stick them in the show, but of their kids with the sunblocks and the hats.
Yes.
Right? And they look so cute.
They do, they do. And if it becomes a habit, it becomes second nature. And I would say also, you know, the second important thing we should teach our children from the very beginning is to take care of their skin in terms of nutrition as well. Because, you know, the old adage, garbage in is garbage out. So the skin has a myriad of bacteria, viruses, yeast that are healthy. And that we need. They're healthy
stuff that's part of the skin.
Right. And those are very important in skin health. And when that gets disrupted, you can start having more skin disease. That's one of the things that can affect skin disease. And to maximize that, you really need to have good nutrition, because your gut bacteria does affect what happens in your skin. So it's all
this is like
interrelated.
the biome that they...
Yes, the skin biome,
very
and the
popular
biofilm.
in the research.
Correct.
So there's a skin biome too.
Definitely. And there's studies recently with trying different probiotics on the skin in people who have eczema. And it looks really promising.
Oh, cool.
So if you restore that balance, so that means that goes into how you take care of your skin, because a lot of the things that we do to our skin disrupt that film, which includes smoking too.
Yeah. Well, that's another important thing to mention is the change of weight. So if children are very obese,
Yeah.
eventually either the skin could go to stria, breakdowns of stretch marks, or if they lose weight afterwards, then the skin is going to be loose and it's not going to be nice and plump and smooth. So remaining in a normal weight is extremely important with the skin.
And that will go with probably better nutrition as well.
Yeah.
So, you know, the whole thing goes together. And
Yeah.
I know it's expensive to eat well and it takes a lot of time. So one should do as best as one can.
Yeah, yeah. So take care of it now because it'll
Yes.
a penny saved
Yes,
right
absolutely.
now. So let's talk about skin cancer. You know, Dr. Armenta, as you know well, I first met you because I went to my annual physical with my primary care doc, and he said, "Hey, Rich, you got a spot over here." It was right here on my cheek, and it said, "It looks a little iffy to me. Could be skin cancer." So, and it was hard to get an appointment quickly with a dermatologist. So he said, "It looks iffy, so I'm going to send you right to the plastic surgeon." So he sent me to you, and I went into your office, and I remember you took out this little looky thing that was very close. You came up. What is that one called?
But it's an episcope. It's
and you got right up there.
Magnifier right on. It's
Yeah.
like a microscope right on the skin.
Ah, cool. And you looked at it and you said, "Yeah, it looks pretty iffy." So, and you took a biopsy, and a couple weeks later I came back, and you came in. I'll never forget. I was sitting on the table, and you put your hand on my wrist, and you said, "Now don't get too scared, but it is cancer, and melanoma. So the good news is it's stage 1, so we should take it off. There shouldn't be any complications." And so I didn't have to have chemo or radiation, and one of the things that I was amazed by too, you know, I'm a vain TV star, right? So, one of my first questions was, after the surgery, is this going to leave a big scar? And you said, in 6 months, you won't even notice it. And it's true. I did, you know, in 6 months, it was like it was never happened. It was amazing. And all the people I told all sorts of people in my life, and people said, did you get that surgery? and you know, it was amazing. So tell me, how did you make that happen? What did you have to do? Because it was right next to my eye, and we had to take out, I know, a chunk of the skin around it so it wouldn't, you know, the edge or the margin, I think you called it. What did you do?
Well, I'm glad you asked that because a lot of the patients that come to me, they said, "Well, I came to a plastic surgery because I don't want a scar." And I tell them, "Well, wrong.
You got to have a scar."
Wrong. You're going to have a scar.
Yeah.
The only things that don't have a scar are lizards. But but you will have a scar. We will make the best possible scar and put it on the crease lines that look like normal lines.
Yeah, I bet if they took a really close look of my face here, you guys, can you get a real close up here? You could see that the scar it looks just like one of my crease lines. Yeah. So I don't even notice it. I would be hard put to find out where it is, you know.
So that's the way, you know, that we try to minimize the appearance of scars by placing it strategically and doing the nicest possible technique that we could to close the defects.
So the moral of that story was it was stage 1, right? So the moral for people who are concerned about a spot, first off, get it checked, right?
It's always easier to come and say, "Hey, this is fine," than to have someone come and say, "I've had this for 2 years," and you're
not a good idea. You don't want to wait that long, because I remember reading a piece of research shortly after the surgery that if it gets to stage 2 and you wait for a while after to have the surgery before you, if it's stage 2, your chance of dying goes up like 50% in just a few weeks. So I was amazed that you really should go fast.
You really should. It's always easier to take care of things when they're first starting or when they're small.
Yeah.
Because the longer you leave them, the bigger scar you're going to end up, the bigger defect you'll have.
Because if the cancer actually kind of grows down into your skin, and then it can communicate through your blood vessels with the rest of your body, and then you can
go
get
elsewhere.
Tumors elsewhere. So you want to get it right when it's right on the top.
Yeah, in melanoma, like any other skin cancer, but in melanoma is worse. The deeper the from the surface to the deeper structures, the deeper it is, the worse it is.
Yeah.
But in melanoma, there have been levels that are made to classified in 4 or 5 is the worst stage, and those are lethal.
Yeah.
Right. So when you cut one out, the
Mm-hmm.
pathologist does give you its depth,
Yeah.
because that has a lot of impact to what you need to do clinically for someone.
Now let's talk about something a lot of people don't know about, something called Mohs, the Mohs procedure for skin cancer. So tell us about that.
Let's let her talk about that.
This is your specialty?
Yeah, so most of the people who do Mohs surgery are actually dermatologists. That can be part of our training. And basically, this is a very targeted skin cancer surgery for most tumors that are on the head and neck, and then certain tumors that are on the body or areas that are hard to close, or depending on the aggressiveness of the tumor. But basically what happens with Mohs is it's processed a little differently than what the regular path lab does. So, so let's say this is your skin and you have the tumor here, and we cut it out, right? The regular lab cuts it in little bread slices and puts random slices of bread on the slide. That's how I explain it. With Mohs, we cut it out, but then what the techs do, so this is the top of your skin, they flip it this way and they start cutting it from the bottom. So you can see the deep margin, and you can see 100% of the surrounding peripheral margin. So this allows you to take smaller margins when you're cutting it out, which is important when you have functional areas like next to your eye, your nose, your hand, various other body parts.
So less damage to the skin.
Yeah, you can take, instead
Smaller
of taking
pieces.
a ½ centimeter or a centimeter around something, you could do it with like 2 or 3 or 4, depending on what the tumor is. And then you wait, so you sit and you wait, and then it's processed while you're waiting. You have a bandage on, and then we look at it under the microscope, and if it's no cancer, you get either sent to plastic surgery or reclose it depending on where the tumors are. If there's more, then we just go to that one particular quadrant, because it's kind of cut in 4, and you repeat the procedure. So the goal is to clear the cancer, but the secondary goal is to keep it as small as possible so you can have function and cosmetics that are acceptable.
And so we're just about to go to our close here, but I understand this is where you guys work together.
This is where we team
Right.
up, yeah.
Yeah, you do the plastic surgery.
And not only I would say in areas where are very small or close to functional portions like eyelid and nose, but sometimes the lesion is not well defined. So you can tell where it starts here,
Where it ends.
but in this other edge, I don't know where it stops. So then it's when I would say,
That's when you do this.
I say,
Great.
most
Well-
surgery, and then, as I say to my patients, they do the destruction, we do the reconstruction.
Destruction, Dr. Destruction, Dr. Regas, that's quite a name. Well, that's about all the time we have. I want to thank our guest, Dr. Joyce Farah, dermatologist with Farah Dermatology and Cosmetics, and Dr. Enrique Armenta, plastic surgeon with Syracuse Plastic Surgery. Finally, we have a tradition here called Laughter is the Best Medicine, and let's see if we can leave you with a good chuckle today. So, team, what did the estate lawyer ask the dermatologist? Who's your next of skin?
Can I use that?
You may use that. To hear our new companion community FM radio show, Check Up from the Neck Up, visit wcny.org/communityfm. And for online extras, visit wcny.org/Cycle of Health. For Cycle of Health, I'm psychologist Dr. Rich O'Neill. Thanks for checking in. And don't forget to wear your hat, your sunblock, and your driving gloves, because people forget you get a lot of sun when you're driving. See you next time.
Next week on Cycle of Health.
Tonight's topic, mosquito-borne illness. Tonight, 2 upstate docs describe their bloody good arboviral research. The County Health Commission talks trap and zap, and protecting ourselves at home and abroad. Slap. Yeah, got her.
Cancer. It's not just a diagnosis. It's a complex opponent, one that can alter the course of your life. Every move, every decision holds tremendous weight. St. Joseph's Health has partnered with Roswell Park, the region's only nationally designated comprehensive cancer center, to offer you access to personalized therapies and leading oncologists right in our community. Among the many moves you can make, this one holds the power to change your life for the better.